Okay, so this is for anatomy, chapter 9, part 2, joint movements, continued. So the movements in the joints can be grouped into four main categories. Gliding, where relatively flat bones move back and forth, side to side, with respect to each other. Angular movements, either, here's your elbow joint, either there's an increase in the angle of that joint, okay, or a decrease in that angle of the joint between those articulating bones. Rotation is a movement around longitudinal axis. So this is rotation between the atlas and the axis in your C1 and C2. Right, and then special movements. Gliding movements are back and forth, side to side. They are typically in the intercarpal joints, so in your wrists. Limited range of motion there. Angular movements, I just showed you flexion and extension. Okay. Hyperextension is if I could do it, it would be even bending past that line that's created in that joint. When you hyper extended a joint, an extension beyond normal extension. Abduction. Abduct, when you take something away, you abduct it. So it's a movement away from the midline. So in my shoulder here, okay, I'm abducting, okay, moving the arm away from the midline where my buttons are of the body. When you adduct, you add to the midline. So moving that arm back down, you're bringing that angle closer to the midline. And circumduction is movement of any body part in a circle. I'm making a circle with my fist. That is circumduction. So here's just some visual examples which are good to look at in different joints and what flexion looks like in this joint compared to what flexion looks like at the shoulder joint. A little bit different. Or abduction and adduction, what it looks like in the shoulder joint compared to any other picture. In circumduction, this guy is making a circle with his foot. Rotation, like I gave you an example, the atlantoaxial joint, that's between your atlas and your axis, okay, rotation. You can also rotate, as you can see in this image, lateral rotation, medial rotation in that joint, or in the leg there. Moving around, revolving around the own longitudinal axis. And then here's other special movements, is the upward movement of any body part. So I just closed my mouth. I elevated that joint. If you take your shoulders and, I don't know, IDK, elevating your shoulders. The opposite of that, depression, when you move that down, downward movement of a body part. So opening the mouth or putting the shoulders down, you're moving that down. Protraction is the movement of a body part anteriorly, while retraction is the movement back to normal. So this one's a fun one to demonstrate. Protraction would be retraction. Go ahead and practice it. You'll look great. You'll just look so wonderful when you do it, just like me. Traction. Okay? Thrusting the mandible outward. This guy's showing elevation and depression, and she's showing protraction and retraction. Other special movements: inversion, movement of the foot medially. Eversion is the movement of the foot laterally towards the outside. Dorsiflexion is bending the foot at the ankle in upward direction, or plantar flexion is bending the foot ankle downward direction. And there's some images of both inversion, eversion, and dorsiflexion and plantar flexion. I want to recommend that you practice all of these joint movements just how the picture shows and say it out loud as you are doing those movements. Supination is a movement of the forearms so the palm is turned upward. I'm supinating something, okay, palm up. Pronation is the opposite, turning the palm down. Opposition is the movement of our magnificent opposable thumb across the palm to touch the tips of the fingers. Same hand. That is the name of it. That's why it's called an opposable thumb, because we're able to do opposition, just like that. Here's a picture of supination and pronation. and opposition. The 5 major joints that for sure you have to know where they're located and the names of them. For this next exam, the temporomandibular joint is between your temporal bone and your mandible. So where those two meet. Shoulder joint, pretty self-explanatory. Same with the elbow, hip, and knee. So here's the temporomandibular joint, combined hinge planar joint. It's the only movable bone in the skull, and if somebody has TMJ or locked jaw, there's something wrong in that joint that doesn't permit proper movement. Shoulder joint, see the image here of the head of the radius with the scapula, and then the clavicle. And we see the elbow joint between the ulna and the humerus. And also in that joint, we also find the radius, the pivot joint there. The hip joint is a ball and socket, formed right there. You can see it's tightly in there. And knee joint is modified hinge. It's actually the largest and most complex. It has the most complex ligaments within it, and there's bursae in there, menisci, so that's why it's considered more complex. And there's just some other images of the knee joint. Remember, this cartilage on top of the surface of the bones is called articular cartilage. If that starts to wear down in any joint, it can cause something called osteoarthritis. So usually osteoarthritis is correlated with aging. So the effect of aging on joints, it does age from person to person, but as you get older, this is something that's going to happen to you. 80-year-olds, almost all of them have some kind of degeneration in either the knees, the elbows, the hips, or the shoulders, okay? Osteoarthritis has a lot of age-related components. The articular cartilage, like I just mentioned, gets thinner. It doesn't create as much synovial fluid. So it's just going to be painful to move those joints. Ligaments shorten, lose elasticity. So like I said, it's more stiff in that joint. I remember my grandma, she was over 80, and I went to give her a hug, and she couldn't even lift up her arms to give me a hug. That's how much arthritis had affected her shoulders in her old age. Oh, same one. There's also a few other types of arthritis, different types of arthritis, gout and rheumatoid arthritis, which I will talk about briefly. But all arthritis, it creates pain in a joint cavity, or the area where the bones meet. There are different surgical things that you can do to help a joint that's suffering. The most common joints that are replaced, hips, knees, and shoulders. And a joint replacement isn't they're taking a whole bone out and replace it with another bone. They actually just repair parts of where the joint meets. Partial hip replacements means they only repair either the acetabulum, they go in and they carve out the bone and put a new surface on, or they take off the head and put essentially a new ball, like a metal ball, other kind of material on the bone. They replace it. So you have new movement in that joint due to the new parts. Here's just an image of what that possible artificial hip joint can look like. It's pretty mechanical and cool looking how they put that into your femur. And look at there's even some pins attaching that in there to make that joint work. There's also complications and a risk with any type of surgery, with any kind of joint replacement, that you open yourself up for increased risk of infection, blood clots, and nerve injury. Here's a knee replacement. This is a total one, so they're going to shave down the femur and the tibia and essentially put a new articular surface on each end. This is cool looking. Femoral component, so this will go on the femur. This is the spacer tibial component, and they can even replace the patella. I think that's pretty cool that they can do.